time marked by rapid technological advancement like artificial intelligence, robotics and other machine learning things. And also you are shifting public health priorities post-COVID era and an urgent need for healthcare that is accessible, sustainable and equitable is very important. We are privileged to be joined today by an esteemed panel of experts who bring with them a wealth of knowledge and diverse perspective from clinical practice, research, policy development, digital innovation and industry leadership. Our discussion today aims to explore how innovation is transforming healthcare delivery, then the role of data, technology and artificial intelligence, challenges in global health equity, the impact of climate change and sustainability on healthcare systems, and how academia, industry and policy can collaborate more effectively. May I request Professor Ibrahim Adia to join the panel. May I request Professor Nimmaraju Gandhi to join the panel. Due to some unavoidable circumstances, Professor Jayakar Shetty couldn't join this session, so he's covering it. May I request Chandrasekhar Subbarao to join the session. He's replacing Professor Asima Banu. She couldn't be here because of other commitments. May I request Professor Vikram Patel to join the discussion session. And also may I request Nagaraj Sarpam Terry to join this discussion as well. Thank you. And may I request Professor Ramesh sir to join the panel as well.
Welcome ಮಾಡ್ತೀರಾ ಪಾಟ್ಸ್ ಕೊಡಬೇಕಾ
arrange with pod shall we give it
ಆಮೇಲೆ ಮೊಮೆಂಟ್ ಲಾಸ್ಟ್ ಈಗ ಒಂದ್ಸಲ ವೆಲ್ಕಮ್ ಮಾಡ್ತೀವಿ ಸರ್ ಮತ್ತೆ ಇನ್ನೊಂದು
ಅವಾಗ ಮೊಮೆಂಟ್
ಈಗ ಒಂದ್ಸಲ ವೆಲ್ಕಮ್ ಮಾಡ್ತೀವಿ
ಈ ಒಂದು ಪ್ಯಾನಲ್ ಡಿಸ್ಕಷನ್ ಅಲ್ಲಿ ಭಾಗವಹಿಸುವಂತಹ ಗಣ್ಯರು ಮೊದಲಿಗೆ ನಮ್ಮೊಂದಿಗೆ ಈ ಸ್ವಾಗತವನ್ನ ಮಾಡಿದಂತವರು ಪ್ರೊಫೆಸರ್ ಸುರೇಶ್ ರೇಣುಕಪ್ಪನವರು, ಡೈರೆಕ್ಟರ್ ಫಾರ್ Wolverhampton-Bengaluru ಸಿಟಿ ಫಾರ್ ರಿಸರ್ಚ್ ಅಂಡ್ ಇನೋವೇಷನ್. ಪ್ರೊಫೆಸರ್ ಇಬ್ರಾಹಿಂ ಆದ್ಯ ಅವರು, ಪ್ರೊಫೆಸರ್ ಲಿಂಗರಾಜ್ ಗಾಂಧಿ ಅವರು, ಪ್ರೊಫೆಸರ್ ಚಂದ್ರಶೇಖರ್, ಪ್ರೊಫೆಸರ್ ವಿಕ್ರಮ್ ಅಂಡ್ ನಾಗರಾಜ್ ಅವರು ಈ ಒಂದು ವಿಚಾರ ಸಂಕಿರಣದಲ್ಲಿ ಭಾಗವಹಿಸ್ತಾ ಇದ್ದಾರೆ. ಎಲ್ಲರಿಗೂ ಕೂಡ ನಾನು ಬೆಂಗಳೂರು ನಗರ ವಿಶ್ವವಿದ್ಯಾಲಯದ ಪರವಾಗಿ ಸ್ವಾಗತವನ್ನ ಕೋರುತ್ತೇನೆ. ಇಂದು ಅವರು ಫ್ಯೂಚರ್ ಆಫ್ ಹೆಲ್ತ್ ಕೇರ್ ಅನ್ನೋ ವಿಷಯವನ್ನ ಕುರಿತು ಚರ್ಚೆಯನ್ನ ಮಾಡಲಿದ್ದಾರೆ. ಧನ್ಯವಾದಗಳು.
Hello? Yes. Yeah, thank you very much. Hello? Yeah. May I please request the panelists to introduce themselves briefly about their organization name and their expertise related to comments. May I ask Chandrasekhar Subbarao to start with.
Hi, Namaste. My name is Chandrasekhar, and I'm actually researching now as part of my PhD on the healthcare and health tech program in India. So in India, healthcare is essentially delivered as a primary central healthcare mission through the Ayushman Bharat digital mission. So part of my study is the healthcare delivery through ABDM. Otherwise, I am employed with SAP Labs, SAP, as an architect, and I work on the analytics space. That's about me. And of course, just a caveat, I'm not representing SAP. I just happen to be part of SAP as an employee.
Afternoon, everyone. My name's Ibrahim Adia. I'm the Vice Chancellor and Chief Executive Officer of the University of Wolverhampton.
Your mic is better? Yeah. I'm Professor Lingaraj Gandhi, formerly Vice Chancellor of Bengaluru City University, basically Professor of English. Thank you.
Good afternoon, everyone. I am Dr. Vikram Patil. I am the Dean for Clinical Research at JSS Academy of Higher Education Research, and I take care of the digital health and artificial intelligence related activities at the university.
Hi, good afternoon. My name is Nagraj. I work for TERI, the Angel Research Institute. Basically, I'm going to explain about how this energy and sustainability and health is very much important here.
Okay, yeah, thank you very much for the introduction. To begin, I would like to ask each panelist a question. Please answer in 2 or 3 minutes, because of time constraints. Yeah. Professor Ibrahim Adia, drawing from your extensive experience in public and health policy, how do you see the role of universities evolving in shaping inclusive and equitable healthcare system globally?
Thank you. Thanks, Chair. So this is a really interesting question around the role of universities and how in particular we can shape more inclusive and equitable healthcare systems. I think the answer is a multi-dimensional one. So the first things that we do as universities and through our research is we try to help governments by helping them to get an evidence-based approach to policy. So as universities, we do a lot of research. We kind of work out what things will make a difference in terms of delivering equitable health outcomes, and then we share that evidence base with governments to see whether that could then influence the shape of policy. I think that's a really important role of universities. But the other bit that then follows on from that is then the implementation of policy, and many universities are involved then in influencing the government and advising the government on what the system architecture of healthcare should look like. And in the UK, I've been involved in the healthcare system for about 20 years, and what we've always strived to do is have a very clear line that the cheapest and most effective healthcare is self-help. Empower individuals, empower communities to look after themselves. After that, we try to work on the basis of community health, because it's always cheaper and more accessible. Then we work on the basis of early detection, early intervention. The sooner you find a disease, sooner you intervene, the better, the cheaper, the better the outcomes for patients. And then finally, you think about acute care and specialist care as a last resort when everything else has failed. So I think that has some very significant consequences for how you design a healthcare system and how you invest your resources to make that work. And I think universities have a really important role to play therefore, not only in delivering the evidence base around what the policy should look like, but also importantly, what the architecture, the system architecture should look like, and what the pattern of financial investment should look like. And that gets us into the business of health economics. And again, universities do lots of research on health economics and how best to use what is a finite resource for the best and most equitable outcomes for our residents, so there is something about that. I think the other area universities have got to play an important part in is working with regulatory bodies. So if the policy agenda is to deliver inclusive and equitable health outcomes, then really the professional bodies have then got to shape a curriculum, whether it's a medical curriculum or nursing curriculum or allied health curriculum, that values equitable outcomes. We don't just create graduates and hope that suddenly, they are going to be committed to delivering equitable outcomes. We've then got to infuse the theory of equitability and the value base of equitability into the curriculum. And you can only do that if you work with your professional bodies. So in the UK, that means working with the General Medical Council, working with the Nursing Midwifery Council, Allied Health Councils. That becomes a really important dimension. The last, or the third bit is the obvious bit, which is we develop the workforce. As universities, we will be training the future generation of medics, of nursing staff, of allied health. And then once again, if we want to deliver individuals who share our commitment to equitable outcomes, then again, the way we deliver the curriculum, the values we instill into that curriculum will really, really matter. But a very obvious role of universities clearly is that not only do we deliver new healthcare workers, but we also upskill. Many universities are involved in CPD. My university has lots of courses now in upskilling hospital consultants in respiratory, radiology, etc., as well as middle grade doctors, as well as nursing staff. The idea that in a very fast-moving world where knowledge is moving very quickly, somebody that trained in their discipline 20 years ago is still current, isn't enough anymore. So we've got to continue as universities to make sure that the workforce, the health workforce, is appropriately equipped to deliver the policy agenda, whatever that might be. And then the last area, of course, is research. I've already alluded to that, but as universities, we get involved not only in general research around social and healthcare that I've already referenced, but lots of clinical trials as well. Certainly, my university supports lots of clinical trials in hospitals. We do the methodology. We've got the statisticians that analyze the data, that start to write up pieces of work for publication. Again, a very important role for universities because often clinicians don't have that information. They can lead a trial in hospital, they can be principal investigator, but they won't necessarily have the methodological knowledge of how to conduct, for example, a double-blind study. And the last bit, of course, is as universities increasingly, we need to move into the innovation space with digital healthcare, and again in the UK, universities doing huge amounts of work about hospital at home. How do you discharge people from hospital early? Because it's very expensive to keep people in hospitals, but then we can monitor their vitals at home through remote technology. There's a whole kind of industry around EdTech, which allows us to monitor the vital signs of individuals living at home, and in the event the signs go in the wrong direction, you have an early intervention team. This was one example of the way universities are reaching into the digital space and enabling healthcare. I can go on and go on, and I know I've done more than 3 minutes, so I will stop there.
Yeah, thank you. Thank you very much, Professor Arya, for your insightful view on the healthcare policy side. The next question is for Professor Lingaraj Gandhi. So, with your extensive experience across multiple academic institutions, how do you envision the role of universities in promoting holistic education that integrates skill development, mental well-being, academic excellence?
Good afternoon to one and all. The healthcare is a broad idea of being well-being. The mental health is one of the major universal concerns. According to a survey estimate, nearly 10% of the global population in the near future requires counseling. So the issue of health, mental health, is a serious concern, and to address it, The role of the university in the teaching learning system, the students, engaging communities, engaging non-governmental organizations are so crucial, especially after COVID-19, where the world affected so adversely, where people were cut out from people, we had to live in isolation, in solitariness. It's an unprecedented universal experience, I must say. The need of counseling, a need of emotional support, the need of care at a real sense of the term, and the role of institutions became very, very important. So designing a curriculum, delivering a curriculum, add-on courses, short-term courses, certificate, diploma courses, and need to connect with other disciplines, not just. So this has become very, very important. Again, the technology came in a big way because the online counseling, online connecting people, online advice, because physical campuses were not there, physical healthcare system were not there. So how in such a scenario the technology was of big help. And my universities, even the previous universities where I worked during the COVID-19 time, whether it's Karnataka State Open University, University of Mysore, and now Bengaluru City University, there was a need to engage the student community. There was a need to continue the teaching learning system in the absence of physical interactions. So then we had to invent new digital platform, come up with new apps to carry on the teaching learning process, to conduct meetings, to hold consultations, and advise students on many issues. So therefore, it is only through universities, because these things were really effectively possible, because we communicate. And again here on Bengaluru City University, when I took over, this is a COVID time, lockdown time, and our students and our faculty were engaged nearly for a year in a special vaccination drive in collaboration with the local government, BBMP, and the government of Karnataka. During the time, between two vaccinations, the first and the second, there used to be a gap of 60 days. There were many students who were enrolled in foreign universities. There were many employees stuck here or stuck there, and there were businesses were cut out. And then the government got the special permission from the center to reduce the time period between the first and the second vaccination. It was reduced to 30 days. Therefore, they can get the second dose and travel for universities, employment, and business. This university was chosen to conduct that special drive for a year from 8 o'clock, sometimes evening, 10 o'clock. Our student community engaged in this. Nearly 30,000 people were vaccinated using our manpower, our support. That's how the university connected with the city during times of crisis. That's how university started responding, and that's how the connect built between. So this is the way university can really connect, whether health or any other activities. I think this is my experience sharing. Thank you for that.
Yeah, thank you very much, Professor Gandhi, for sharing your experience. How do you bring university to address mental health, well-being, and academic excellence? The next question is for Chandrasekhar Subbarao. Chandra, you mentioned that your research is focusing on Ayushman Digital Health Mission. As you know that with India advancing towards a more digital economy, and also it plays an important role in digitalizing healthcare sector is happening. Yeah, based on the information, one of the biggest and largest digitalization of healthcare across the world. Based on the statistics, it says 10% of India's GDP they're investing on that. From your experience, your research, how do you see the innovations through ADBM helps to enhancing accessibility, affordability, and equity in healthcare delivery across both urban and rural regions over the next decade or so?
Thank you, Professor Suresh. Thank you very much. So that's quite a loaded question. So maybe I should just start by giving a context or a quick explanation about what ABDM itself is. So ABDM itself, as the name itself suggests, is Ayushman Bharat. Is Ayushman Bharat Digital Mission. So the name itself has digital in it. So the aim is to really build a digital health infrastructure for the entire country. So what does it propose to do? Building health infrastructure means what? So the health infrastructure obviously has to be connecting the entire healthcare ecosystem. So this healthcare ecosystem right now is kind of very fragmented, and the healthcare delivery itself is very siloed. I will probably start by giving a very, very simple example of how healthcare is kind of disconnected. Okay, healthcare meaning the healthcare delivery itself. So if I go to a hospital today, I can get myself enrolled for some tests, etc., and then I walk into another lab for getting some more blood tests and some more tests and whatnot. So where are all of these records? Okay, so how do I get these records? So if I go to a hospital, they will have my record. I'll go to a lab, they will have my record. So tomorrow, if I have to consult another hospital, another lab, I have to physically carry all of these with me. It's a very, very simple problem to start with. But starting here, you will see how the core of ABDM, the digital mission, is actually rooted in the fact that there has to be something called a electronic health record. So this the creation of the electronic health record, okay, EHR, so that is the primary requirement for any digital mission to take off. So for this, they have ABBA actually came up with this ABBA, they give something called the ABBA account, Ayushman Bharat account. So there is something like the, the Aadhaar card, we also get an ABBA card. So that is the identifier for all of our health records. So like I was giving you an example, right? So this is just a simple example of how health records will kind of make the records available to me, and it becomes part of my records, my repository, my digital repository. So that is what ABDM proposes to do for the purpose of digitization of records. That is fine. So, but what is the bigger aim? So what is the healthcare ecosystem itself? So there was a question about how it can actually enhance delivery of healthcare to rural areas and how it actually brings about equity, etc. So that is quite difficult. It needs a more comprehensive answer. But yes, this is in the mission and the vision of ABDM itself. Okay. So what is the ecosystem of ABDM? So if you look at the healthcare or the ABDM ecosystem, it consists of policymakers, the state government, the central government, the healthcare facilities, the hospitals, clinics, third-party integrators, insurance companies, health tech providers, health tech companies which are actually building these solutions. They include even Ayurveda doctors, Unani doctors, and many other streams of medicine. They are also included in the ecosystem, and there are individual healthcare professionals. So we need a system to bring all of the players in this ecosystem together. Okay, how do we do that? Through a digital backbone. And what is at the center of this backbone? The center of the backbone is the patient. So this patient can be a rural patient, it can be a urban patient, it doesn't matter. So the digitization itself, or the mission of digitization itself, will actually bring about quite a bit of equity in the delivery of healthcare. Okay, so that is one part. So what was the other? This is
we
about
see the innovation of
the innovation. Okay, so now this, how does it actually promote innovation? Now we are already seeing that there are many. In fact, if you look at the startup scenario in India, the second largest number of startups is in the health tech space. The first is in the fintech space. There is a very close competition between fintech companies and health tech companies. Now, how is this possible? Today, if you look at all of these startups, most of the startups are doing something or the other to integrate into this ABDM stack. Now, what is this ABDM stack? It is a centralized digital infrastructure stack that has been provided by the government itself. So why do they do that? First, of course, to integrate the entire ecosystem, but then it opens up a platform using which people can actually start creating solutions and delivering solutions. So it can be a simple appointment system, it can be a simple repository of records, it can be it can be a AI-enabled solution, anything. But all of these today are leveraging the India AI stack. Okay, they are doing something to integrate into ABDM. So that it has actually triggered a huge wave of startup companies and innovations in health tech.
Okay. Thank you very much, Chandra, for shedding some light on Ayushman Bharat Digital Health Mission. Yeah, the next question is for Professor Vikram. As someone at the forefront of integrating artificial intelligence into the healthcare system, how do you see AI transforming healthcare and clinical decision making in the near future?
Thank you, Dr. Suresh. So, as a passionate person towards integrating AI towards healthcare, we have been looking into AI in healthcare as two main things it can do. One is early detection of a disease. Second is reaching out where the healthcare is still not reachable. According to a recent World Economic Survey, actually, almost 450 crore population across the world still don't have access to good healthcare. And some of it is in India as well, especially in the northeast regions or the hilly regions or the rural population. So there we see AI can play three major roles. One is it can be an intelligent assistant. As an intelligent assistant to a doctor, we see now a doctor with knowledge of AI will probably replace a doctor without a knowledge without AI. We are not saying AI is going to replace doctors, but we are going to see doctors with knowledge of AI is a must. In that, again, we are seeing three categories of people. One is some basic knowledge, which is a must for everybody. Some is proficiency of knowledge, who can criticize and understand responsible and ethical AI. The third is an expert. Maybe there's a small percentage of people who need to be experts, but majorly we are looking at basic and proficient people who understand AI. That's more than enough. So AI is going to be an intelligent assistant, especially with fields which I am dealing. I am a professor of radiology. I see radiology slowly being taken over by AI. We have seen AI significantly having more accurate capacity of interpreting reports compared to what I can do. So their consistency is more, their accuracy is more. So radiology is being taken over. Similarly, pathology, dermatology, wherever image basis is there, it's being taken over. Next, we see electronic health records also, as already mentioned by Chandrasekhar, especially with Ayushman Bharat digital mission coming into play. Health records are going to be integrated to AI probably in future, and we may come into an era where we start looking into not just general AI, but a predictive AI, a predictive what is going to happen, when is the next dengue outbreak going to happen, when is the next typhoid outbreak going to happen, or how is the sepsis in a particular hospital. All these things can come into play with AI. The next big thing probably will be personalized medicine. We all take probably the same Dolo 650 for our headache. It may be a change where we may have to customize the medicine. Maybe somebody requires a 500 mg, somebody requires something else. So there should be a personalized care, and that is going to play a big role, especially with genetics coming into play. So this, and apart from this, the last one I feel is reaching out to the unreached, the unserved. That's where AI is going to play a big role. So according to me, the main three roles will be as an AI assistant to a doctor, the second will be in predictive and personalized care, and the third will be reaching out, unreached. Thank you very much.
Yeah. Thank you very much for answering in such a lovely way, Vikram. Like most of them think AI will replace doctors, so you are sure that you are not, the AI is not going to replace the doctors in the near future. Yeah. Thank you for that. According to World Health Organization, more than 300,000 patients died because non-availability or accessibility of power, particularly in rural and semi-peri area. Based on your work, Nagraj, is it possible to share some light on your work related to primary health care services in villages? How you are decarbonizing or solarizing the primary health services, please?
Thank you, Suresh. So basically, if you go into the rural areas, mainly in primary healthcare centers, these are challenges government also facing. Like one is staff, basically, like doctors and nurses or supporting staff. That is the one thing. But now government is putting a lot of effort and filling that. And second challenge is the infrastructure. Many things are there, like each PHC have like ECG machines and birthing tables and examination beds, diagnostic tools, refrigerators, autoclaves, like that. So many things they have established. But third one is the challenge is like somewhere it's looking and somewhere it's not looking. That kind of thing is going on. That is energy supply. So electricity, that is a major challenge now in rural areas people are facing. So even though like we are claiming that it's electrified villages and everywhere it is electrified, we are claiming, but if you see the like in depth, if you go into a little bit remote areas or like forest range areas, like very remote areas, so there electricity is there, it's all electrified. But if you see the quality of power is very poor. Like even from our institution, like we have done many works in rural areas, and we also conducted some energy audits in villages. So major problem is like voltage. Like at least 250 voltage is the minimum requirement of the voltage. But what we see is the 150 and all. So if you have 150 voltage power, then you can't operate any infrastructure in the hospitals. So that's what we have seen. Like for this problem, as a solution, we have implemented one project in Chamrajanagar district in Hanur Taluka. So Hanur Taluka is a completely, it's a forest based area. So we identified 5 PHCs there and established the solar system. But in depth, once we study, we come to many things there. Like one is quality of power, and then using of infrastructure, and then skilled manpower. So many things. So here the requirement is very minimal. Like we need only, I can say technically, 3 kilowatt system is sufficient for one PSC for operating minimal things. It will not be completely, no need to operate a water pump and all. At least you have to operate some refrigerators, some diagnostic tools and lab equipments. So that will serve the purpose. That's why like 5 PSCs were electrified with the solar. So after that we have seen many changes in that actually. Like even doctors were very comfortable because these PSCs are in forest area. Like in the rainy season it's very difficult. Like if power goes, it will not come back by 4 or 5 days like that. So like in that areas, like people are only completely dependent on these PHCs. like many times even night time if any delivery cases comes and all, the doctors face a very problem. So even sometimes they use mobile torches, mobile light for performing the operation and all. So, but providing even simple light itself, it is a lot of it changes. So what my suggestion is that we have to integrate this sustainable energy into the health, so that we can achieve more and more results. So that's what my this thing.
Yeah. Yeah, thank you very much, Nagaraj, for sharing your experience, particularly in the villages, a remote part of the state of Karnataka, like Mallai Mahadeshwara, that Annuru Taluk. So his work is really impacted many the rural population. As Nagaraj was mentioning, they usually used to use mobile or kerosene lamps to deliver baby. So because of his small initiative, it changed their the behavior, and they experience very positive experience. That's how research is very, very important. Yeah. So to move on to the second round of questions, Professor Arya, you have been deeply involved in driving economical strategy in Greater Manchester in your previous life. What do you see as a fundamental relationship between economic strategy, healthcare and sustainability, and how can universities contribute to developing that goal?
Thank you. I mean there is a fundamental interdependency between economics, the environment and health. There is no doubt. And the role of universities is significant in all three. I think if we just unpack this, let's just start with what we know about good health. And all the evidence we know about good health is that to some extent genetics are implicated. I'm not a doctor, but those of you that are doctors I'm sure will attest to that. But other factors are also significant, and we know environmental factors are significant. Sanitation, air quality, water quality, mental health, crime in an area, economic independence, dignity, all that kind of gets implicated in somebody's personal health care. So that's kind of really important to start with. And of course, as universities, not only do a lot of research around the determinants of health, but we also support lots of workforce development around public health, etc., which particularly supports these dimensions of well-being. The one thing I want to unpack therefore is the economic role of universities. And the fact that as universities we see our role as supporting economic development of an area, and an area is economically successful, able to levy taxes, it can then invest in healthcare, it can then invest in good environments. So that cycle is a really important one. So I just let me isolate the role of universities in terms of economic development. My university, we see ourselves as an important anchor institution with a very clear civic mission. And part of that civic mission is not only upskilling residents and reskilling residents, but also consciously supporting the economic development of our region. We see that as a very important role that we play. The most obvious and simple role we play is that, my revenue in any given year, so let's take the forthcoming financial year for 25-26, my revenue will be about £242 million a year, which supports 2,200 staff. That's a lot of livelihoods that we support in the area for whom we provide economic independence. It's a very obvious thing that we do as a university. But we shouldn't underestimate how much of that money goes into supply chains in my region. The number of people we support through other jobs, catering, maintenance of our buildings, new estate developments, those are kind of jobs we create all the way through the ecosystem that we should just recognize as an economic contribution that universities make. Beyond that, I think our contribution still is significant. So, let's kind of just think about the fact that we take many residents at a level of skill and experience And when they graduate, they leave with another set of skills. Highly skilled graduates who then make a massive economic impact, either in country or outside the country. All the research evidence shows that where employers are hiring graduates, they are likely to be more productive, because graduates are bringing fresh thinking all the time, fresh energy. That's an obvious economic impact. The second bit we know is that graduates tend to set up businesses more so than non-graduates, and they're going to create jobs. Another very obvious economic impact we make as universities. And the third area is where you have a highly skilled workforce in any given region, that attracts investment into that region, particularly foreign direct investment. So my region in the Midlands, we attract billions of pounds of foreign direct investment from the Middle East, from China, from America. Why? Because there is political stability, fundamental, everybody understands the rules of the game around the economic models, but there is also a highly skilled workforce they can tap into. Investment was always chase skills, and therefore as a university, by creating highly skilled people, we generate foreign direct investment, and therefore we create that virtuous circle of economic success, which then results in better environmental protection and therefore better healthcare. So, on the final bit I would just say is that we should also not forget the economic impact of universities in terms of our role around research, innovation, commercialization, and helping businesses to become more productive. And if anything, from today, when we talked about the new research centre we've set up here, that's fundamentally what it's about. It is about helping businesses to become more productive, become more efficient, and actually in the process, by using less resources, becoming more environmentally sustainable. That is the fundamental proposition that we're here with. So just to back to your question, there is a fundamental interdependency between those three dimensions.
Thank you very much, Professor Adia.
I think I have a second round of questions.
Yeah. Professor Gandhi sir, based on your experience in managing COVID-19 pandemic, how do you assess India's current level of preparedness for future public health emergencies or pandemics?
I did answer this question partly before, because COVID-19 is certainly an unprecedented sort of experience for globally, and that also awakened the world in a way never before, be it education system, be it health, be it business, be it science, technology. Every aspect of it was affected by the COVID-19, where everyone is cut off from everything. So that's also a time where we realized that world has to come together because we are mutually dependent. Every sector is dependent on the other, every domain is dependent on the other, every discipline is dependent on the other. So therefore, multidisciplinarity and multi-connectivity became imperative. And education system needed to reinvent its curriculum, reinvent its delivery, and that's certainly healthcare as well. So therefore, as universities, as knowledge hubs, we also need to develop new content in this direction in all spheres, all realms of life, including sector. So the university's role, the role of education institution, education system is to be redefined. So this way it also led to the collaborations, partnership, cooperation. And this is one of the reasons that the world is reawakened, and we are all here today sharing each other's experience in every other domain, And this is inevitable if the world is to move forward. The togetherness, collective struggle, and sharing of experience, sharing of knowledge, and disseminating coming together. So, and this is, and healthcare system is no exception to this dependency. And so it has, the world which has cut out again is being reunited. Countries are being reconnected. People are being reconnected. And we're also reinventing every system, including the education system. So thanks to COVID, in a way, it realized the oneness of humanity. Together we live and together we should exist. If there is no togetherness, we cannot survive and progress. Thank you.
Yeah, thank you very much, sir. Thanks. Chandra, you mentioned your research is looking at adoption of Ayushman Digital Health Mission in India. Based on your opinion or based on your research, what are the challenges India is facing to adopt the ADBM?
Thanks for the question. Yes, the Ayushman Bharat mission actually was started around 2020. So 2020, end of 2020. So it is still a nascent mission. It is not something that has been running for a very long time. So the problems in the adoption of ABDM are actually becoming evident only now. So there are quite a few of them, but I may not be really enumerating all of them, and not in any particular order of which is the most difficult challenge or the most important challenge. But a few of them that occur to my mind. One important challenge is the integration itself. So when I say integration, there are two integrations that I refer to. One integration is with the programs, the healthcare programs that many of the states may already be running. So for example, Karnataka itself has the Ayushman Bharat, now it is called the Ayushman Bharat Karnataka. So that is the ABDM KR. So likewise, many of the state governments already had some or the other equivalent healthcare delivery mission or program that was already running. So when there was another system that came in from the center, everybody had to adapt and everybody had to integrate into this ABDM. This was one level of difficulty. So this level of difficulty also entailed, policy integrations also. So not just technology integrations, but policy integrations also. So the next integration is about, just like how, governments can already be having systems, there are already many digital systems. Today, if you look at the healthcare, if you go to any simple hospital, they will be running some or the other, digital system, right? So they will be running a simple hospital management information system. It's called HMIS. If you go to a lab, they run something called LMIS, lab management information systems. So they're already running this. Now somebody has already provided this. It's not come from one single vendor. There are hundreds and many thousands of vendors who have actually provided these systems. Now you say, I have a different system. I am going to be telling you how to integrate into ABDM. All of them will have to make changes. All of them have to do quite a bit of, put in quite a bit of effort to integrate into, the new ABDM stack. So this is another challenge. But the good part is people have accepted, and there are very, very many successful integrations that are already in place and they're already going on. So this is one of the challenges. Another challenge is from a user's perspective itself. Any digitization for that matter is not very easy. There will always be some resistance. This resistance could be because of the ease of usability itself. It could also be because we do not understand or trust the system. When I say trust the system, you have to trust it is my health data. So we have to be sure where my health records are going, who is going to be keeping track of my health records, is it going to be safe, and how am I going to be sharing my health record from one or institution to another, or one hospital to another. How am I going to share? So there is an elaborate consent framework which has been proposed by ABDM itself. So one of the barriers or challenges that we encountered when we actually started, working with or interviewing some people was the consent framework was quite, complex. It's very difficult to actually understand the consent framework itself. So this is another challenge. And of course, there are other challenges like the cost of actually integrating. What is the benefit for me? What is the incentive? Why should any hospital actually empanel themselves as part of ABDM? There has to be enough incentive and motivation to do that. So maybe there has to be enough communication for people to really understand the benefits of ABDM itself. So this is also another challenge. I think these are like some of the top challenges that come to my mind. There may be, and there will be many more, but I think these are the top ones.
Yeah. Thank you very much, Chandra, for sharing the challenges. Yeah. Professor Vikram, like more than many management consultants and management gurus, they says more than 70% of change initiatives fail to take up the intended purpose. Based on your experience, what are the key challenges and opportunities in adopting artificial intelligence technologies in Indian healthcare and education settings?
Thank you, Dr. Suresh. So again, we have spoken a little bit about already the opportunities earlier, but just to add a few more, I would think, apart from what I mentioned, maybe there's operational efficiency would improve. Maybe also we can see the insurance sector will improve. And there are few more opportunities, especially for the healthcare sector. But coming to challenges, especially in the healthcare sector, we see it's all about data. So when you have good quality data, good quality AI is going to come out. AI is all about data. So in India, there is still a lack of structured data, good quality data. So if garbage goes in, garbage is going to come out. That's how it's going to work. So we have to first work towards organizing our data, making sure our data structure is good, and then probably we'll come out with better AI tools, more generic AI tools, because I was just discussing with some industry consultants recently, whatever we are doing right now is all dependent on internationally available standard data set and trying to apply it on our patients. Whereas that is missing, there's a missing link, because our data sets are going to be different, our genetics is different, our imaging is different, everything is going to be different. So first we have to improve our data set. That is the biggest challenge, and organize it. So once we do that, I think half of the job is done. And coming to the education system, I see there is a lot of opportunity. AI has come a big way, and we see AI right from fridge to AC to car, everywhere AI is there. So AI can't be left out of the education system. So we see AI as an integral component of every student nowadays. So we at JSS have started up an initiative. We are revising the whole curriculum of the Pharmacy Council of India. We started with pharmacy, then the idea is to move to life sciences and medical and dental. In India, we have a structured curriculum across India for these regulated bodies like medical MBBS. There is a structured curriculum, but we are thinking, why not add an extra curriculum for that? Why not add a few credit points and create a new additional point so that student gets adapted to the newer curriculum? So this way, there is a lot of scope for artificial intelligence to come into curriculum. The regulated mandatory teaching is going to be done, but additional we have to do. Also offer elective courses, also offer newer courses, emerging health technology courses. If we start doing this, then I think we will improve the quality of education in India. And I see only few challenges over here. The challenges which I see in the education system is, right now still there is no structured, as we have seen some certain institutions like Cambridge or in the US, certain institutions like, I think, I'm not recalling. So these have started designing a curriculum for their medical students, for their farmers. So we have to start adapting certain of those curriculum into our ecosystem so that our students are also well prepared for the future. And we have to have resources for our teachers to get trained, because still there are no unless the teacher is trained, the student can't be trained. So we need resources for our teachers as well. These are the two major challenges I feel for education system. Thank you.
Yeah, thank you very much, Dr. Professor Vikram. Like a train the trainers is a very important concept. Yes, okay. The next question is for Nagraj. Nagraj, when you are trying to solarize the healthcare, particularly in rural area, what are the challenges you faced?
Thank you, Suresh. So, challenges are, many things are there, but one thing I have to tell you is, first we have to come out with compatibility to some other level now, because comfortability is like just going there and putting switch, will light the bulb and whatever things will on. But challenge is like people don't know like how much 1 kilowatt or 1 minute power generation is how much we are generating carbon, and even it is traveling from so many kilometers, power will transfer to the hospital. So that's the reason, like this is the first challenge, like people has to change from comfortable level to some other level, so that we can adopt this renewable energy. Because in renewable energy, there have some limitations, and we have to train these people or staff to learn about the technology, so that they can operate the system and they can generate the power and they can utilize in a sustainable way. But whereas in conventional power, it's like many problems are there, and it has to transfer from many kilometers. And another important thing is like they are also paying bills actually. Even many places are overdue with the bills actually, like many thousands, like 30,000, even I have seen like 20,000, 30,000 bills are pending. So due to government has not paid bills. So these are all the problematics. Like that is the reason we have to shift from this conventional level to this renewable energy level, so that they can use, and then they can use sustainably, and then they can save the power and then even bills also. So that is one thing. And another challenge is right now in whatever existing system in the hospitals, we don't have any energy person, like electricity based person. So these hospitals are dependent on some contractor or some local electrician. So whatever they say, they have to listen. So this is the kind of thing. So if you want to go for this solar energy or renewable energy, so there should be one energy person in the health sector, so that he will guide the like other people, and he can utilize that power. So this so basically, like in future also, we have to create one part, like energy part in the health system, with a pakka, like systematic staff and systematic skilled people, so that it will be easy to come out with the challenges. Thank you.
Okay, thank you very much for highlighting some of the challenges we faced in solidification of healthcare sector. Yeah. Let's now open the floor for the audience to ask any questions or doubts you want. Yeah. Let me open the floor for audience to ask questions. Anyone got questions for Professor? Yeah.
Good evening all. I am Gautam, research scholar with you. My question is, what are the measures taken to address the data privacy concerns in healthcare digitalization? Yeah, I would like to take it here. Government is taking certain initiatives, especially with Ayushman Bharat Digital Mission coming in. Until now, it was all in the local hospitals. If it was in JSS, for example, I was taking care of it. Whereas now, with the government pitching in, Ayushman Bharat Digital Mission has set in certain guidelines of data holder, data fiduciary is what it calls them. So data fiduciary is responsible for data security and data privacy. Although still there are challenges, and we have seen premier institutions like AIMS data getting hacked. We saw a lot of high-end institutions data getting hacked. So there is still challenges which is being addressed, maybe with blockchain technology coming into play where EHR becomes more robust. But still there are measures which government is taking, like with these fiduciaries holding the data, making sure it does get leaked. And also there is a clause in the National Digital Health Mission that data is a patient's right. It can be utilized for research only in an anonymized manner or with the consent of the patient. So this is certain guidelines which government has framed, and we are all abiding by those guidelines, and probably that will be the basis for future research as well.
Hello, sir. I'm Ashwan, studying in BCU. So, what are the barriers that are involved in health tech innovations? So, we are implementing these AI models and all. So, what are the barriers involved in this healthcare sector?
Barriers in the
So was the question about what are the barriers in adopting health tech? Or
So, we are nowadays digitalization we are doing. So, particular to this healthcare sector, what are the challenges we are facing in implementing these AI models and integrating it?
So one, if it is only about AI models, I think Dr. Patil has.
I had already answered it, but just to add, there's one concern is the regulatory aspects. Because now still, who is going to take the onus? If I do a mistake in reporting my chest X-ray today, I am responsible for it. If a XYZ company makes an AI model and their model is used for reporting purpose, who is going to take the onus? So there are certain regulatory concerns still. So that's being addressed again. So regulatory framework is being prepared by the government again for the across India. And probably with that implementation, these concerns, that is the biggest barrier right now in adoption of AI for general purpose usage, is what I can say.
Thank you, sir.
Sir, I have a
Thank you.
question here. Sir, you were mentioning about how digitalization can bring about equity in healthcare. We have already heard from Professor Vikram Patel that there is a rural-urban divide where the infrastructure is not sufficient in the rural areas, while in the urban areas it is quite good. So do you think this AI will bring about equity in healthcare sector? I'm Malini.
Who's asking?
So, for a particular answer about how AI itself can address this divide, maybe Dr. Patil will be able to answer better. But if it is just about digitization, yes, there is already, I mean, it can actually bring in a lot of equity. For example, ABDM, one of the flagship programs under ABDM is telemedicine. So telemedicine, remote consulting, remote, healthcare delivery, etc. These are all parts of, envisaged solutions under ABDM itself. So this is one very, low-hanging fruit through which this healthcare delivery equity can actually be brought in. So anybody in the rural area, they require is a simple connectivity. So there are also proposals where the primary healthcare center, so there will already be primary healthcare centers or taluk level healthcare centers. If they simply digitize that one place, okay, anybody who goes there can avail of telemedicine, avail of, healthcare through telemedicine. So that can bring in fantastic equity. So this is just one of the ways.
I'm afraid in the interest of time, it has to go to vote of thanks.
Yeah, thank you, madam. Thank you, Professor Suresh, sir, for facilitating everything. At the outset, I congratulate and thanks I would like to express our sincere thanks to our Honorable Vice Chancellor of Wolverhampton University, Professor Ibrahim Adina. Sir, you have highlighted the significance of research, the significance of policy formulations and facilitating for the policy, and the significance of curriculum framework in the universities, particularly training the staff and upskilling the students and staff members in the university system as part of sustainable avenues. Thank you very much, sir. Your words of wisdom will be taken care in the future academic activities of the Wolverhampton Research Center. Thank you very much, sir. And I would like to express our sincere gratitude to our Honorable former Vice Chancellor, Professor Lingaraj Gandhi, sir, for your active participation in this first panel discussion. Your experience definitely during the COVID time, your contribution through Bangalore City University to the Bangalore citizens, especially for taking their visas to travel abroad and vaccination, everything,
for sharing your valuable experiences. Sir was highlighting about the significance of mental health and understanding the scholastic related issues in the academics and all that. Definitely they are the sustainable avenues and they need to be transformed policies. Of course, the NEP as well as SCP contains the counseling and mental health issues. So thank you very much for your wisdom, sir. On behalf of Wolverhampton University and Bangalore City University, I express our deep gratitude to Professor Lingra. Thank you, sir. And I would like to express our sincere thanks to Professor Chandrasekhar, sir, Dr. Chandrasekhar, sir. Sir was highlighting about the significance of affordable healthcare and digitalization of the healthcare with his experience in the entire healthcare related activities. Thank you, sir. Thank you for your kind words. And I would like to express our sincere thanks to Professor Vikram, sir, for your kind words and involvement in the entire panel discussion. Thank you, sir. And also, I would like to express our sincere thanks to Dr. Nagaraj, sir. Sir was highlighting the significance of sustainable alternative energy in the field of healthcare system. Thank you, sir, for your kind words. I would like to express our sincere thanks to Professor Suresh, sir, for facilitating the entire panel session. Yeah. Thank you, Nanda. Yeah, thank you.
It's my great pleasure to welcome you all. First of all, I would like my panelists to come on stage. So I would request Mr. Karthik, Mr. Krishna, Dr. Nayana, Mr. Shrikant, and Mr. Rahul to please come on stage. And I request all the panelists to please come on stage.
Yes. Yeah. Good afternoon, everybody, and welcome to the last panel session. This is on green innovation, and this panel is going to be facilitated by Professor Ritika Sinha and myself, Professor Subhashini Suresh. It is my great pleasure to welcome the panel members as well as all the delegates in the room. Without taking it further, I'll introduce our panel members. We've got Professor Prashant Pillai, who's the Pro Vice Chancellor for Research and Knowledge Exchange, University of Wolverhampton. The second panel member is Rahul Lodhi, Vice President, Head of SAP Artificial Intelligence Technology India, Global Head of Engineering. Dr. Nayana Shahbadi, she is from the JSS Academy of Higher Education Research, Department of Community Medicine, and her specialization is climate change and public health. Then we've got Srikanth Venkatesh. He's an architect, designer, and entrepreneur representing the Ecomini Studio. We've got Karthik Kumar, Executive Director, IT, Deloitte Shared Services. And we've got Dr. Krishna Prasad, former MD of Mercedes, and Executive Director of T-Rex. So welcome all to this panel. And the way we are going to do is me and Professor Ritika is going to ask the warming up questions, and then we'll open up the floor for question and answers.
Very good afternoon, everyone. We are going to start our session on green innovation. And I would like to bring to the notice of everyone that today is also a World Earth Day. So our inauguration of our session, our WBC Center has happened to be on World Earth Day. And one of the main focus is on sustainability. And so here we have the panel all which are specialized in green innovation and sustainability. So I welcome you all to this session, sir. My first question is for Prashant Pillai. I hope you have a lot of expertise in digital transformation, and also you have leadership played a very important role in Green Corridor. So with this kind of experience and expertise, how do you envision this collaboration of WBC Center, and what kind of collaboration, what this collaboration can get us in advancing towards the green innovation and sustainability initiatives?
Okay, thank you very much for the question, and also thank you for the green welcome, actually. So this is really good. So from my side, when I look at green innovation, I think the whole concept of the Wolverhampton-Bengaluru Research Centre kind of underpins the different areas and themes that we want to look at. And green innovation is something that's really very important for us as a university at Wolverhampton. So that's our priority number one, theme number one. If you look at our university's vision statement, it talks about supporting sustainable societies. And it's something that we're really passionate about. And we are looking at quite a lot of different activities around green innovation. I think the first thing is also to understand what is green. You know, it's not always only about plants and earths as stuff, but what we're looking at from GIC, which is Green Innovation Corridor, is really looking at how can we actually support businesses and society to become more sustainable, end to end, you know. So that's whether you're looking at products, you're looking at services, you're looking at support mechanisms, you know, the businesses themselves, you know, how can we really find a way to bring researchers, innovators, entrepreneurs all together to try and start looking at some innovation within that whole sustainability arena. There's quite a few things. So if I look at WBC, we know why this is important for WBC is the whole sustainability thing is not a Wolverhampton problem, and it's probably not just a Bangalore problem as well. I think it's a world problem. And we need more researchers to be collaborating on that together and looking at what can we do together in order to be able to take some of these initiatives. So I think those are key, and I think WBC will give us that really good platform where we can bring not just researchers from Wolverhampton University, but all our partners that we work with in the UK. So our regional partners, the other universities within West Midlands, for example, our key collaborators within the region and beyond in the UK. But then also we can have the same conversations happening here as well. And the key thing is then how do you kind of facilitate those innovations taking place? How can we really make sure that we work with industry to understand some of their needs and some of their challenges? And where is it that we can bring some of the researchers coming in, working and supporting that? And I think that's quite a key aspect. So I think from my point of view, WBC and GIC will go hand in hand. While the Green Innovation Corridor is quite a big program, it's over £200 million worth, program. We've already got £27 million to start phase one. The construction work and all of that is starting. But we already have a lot of expertise in sustainability. I think I mentioned that in the inaugural speech as well. You know, this is not something new for us. We've been doing this for 2-3 decades actually. Different aspects around sustainable development. So we've got a Center for International Development, which looks at sustainable development, and that just did a 50-year anniversary. You know, so we've been engaged. So we've done work across 130 different countries, actually, looking at sustainable development projects and practices. So it's again, how do we bring some of that work together, the experiences that we've had at Wolverhampton, the experiences that you guys have had here at BCU, how do we bring all of that together? We've got eminent people from industry as well. How do we really look at that and join all of that? And I think that's quite key. It was mentioned in the previous panel as well that, you know, bringing academia, public sector and private sector together, I think is very, very important to be able to tackle some of these big problems, because there's a bit of solution or tech solution to it, but there's a lot of policy solutions to it as well. And those need to go hand in hand. Otherwise, we won't really realize what we want to do. Well, thank you.
Yeah. The next question is for Rahul. Taking the tech view of sustainability, with your leadership in SAP, how do you envisage artificial intelligence transforming the sustainability agenda to large organizations such as yours?
Yep, I think it's a great question. Firstly, honored to be here and inviting for the summit with the distinguished panel member. I think it's really that we're having the academia and industry collaboration is very important as we build up the more skills that we require. At the same time, the more research that we need to build the products that, especially on the AI side, when it's running at very faster pace to bridge the gap. The very important question right now, how do we look at the sustainability and AI bringing together, especially in the context of the how we build the product, or how does the industry work across the place. So firstly, we look at, especially if we had a good discussion on the healthcare, right? And that's an important part, that if you look at how does we bring the sustainability in healthcare and manufacturing, automobile sector as well. The first part is predictability. So how can we reduce the certain amount of wastage that I would bring into the product in order to improve sustainability as well. There is a, especially in the medical and healthcare sector, there is a batch that we look at how can we reduce the number of wastage of a batch because the small changes can be lead to the complete batch could be goes outdated or get expired at the faster pace. So the AI has been working or we build the solution around it, saying that look at how the AI can be look at to have the right portions or what has been the issue in the past and how we can improvise that aspects of it. The second part comes around the especially the sustainability aspects is the how we are procuring the solution or how we are building the raw material. Can I get the end-to-end end-to-end life cycle of the whom I am buying the product? Are they also using sustainable material when I'm getting the raw material from them? Can I also have the predictable my supply chain around that as well, because the disruptions are happening at the faster pace? Does I also get the right reliable vendor where I can be using the blockchain and AI based solution where I can see really the solution that or the raw material that I'm using in my my production, does it also has a sustainable component to it or not? So that's a important aspect that we look at it when it comes to supply chain, and that's also the very important part. It comes to the AI would work in the predictable way. And that's another disruption part that we look at the digital supply chain at this point of time, how it's transforming with the AI and AI agents that we are trying to deploy in the multiple spaces. We spoke about the COVID-19 quite a lot, and that's a point of time that we saw the huge disruption across supply chain happening at the different places, and how we build a product that can really learn from the model faster, provide the alternate vendors, provide alternate capabilities without compromising with the quality. That's something we could build from the AI perspective, can provide those kind of aspects. I think the important part also comes with the ESG reporting now, right? Because that's every company has been mandated to provide the governance around the given sustainability part. And that's where AI is playing an important role, that how does your end-to-end organization is using your carbon footprint is not in the at the product that you are building, the supplier that you are bringing solution from, and the target that what you have for organization, how AI can use to improve that from end-to-end perspective. Look at also now a lot of AI agents. That's something we use also in the from a technology point of view. It has been evaluating at the I would say larger space where the ESG report to get the insight across your organization, whether you are procuring the product, whether you are doing travel, where you are consuming the green gas energies, or how are the solar energies that you are consuming. So how is your footprint that you are using, not only for the product but also your employees been using the carbon footprint to bring it here, and provide the solution around it as well to see that how you can optimize it with the certain ways. And that's where we see many nowadays many companies also start adopting the electric car for their simplest thing to have the electric footprint for their inside using most of the cabs or shuttles. We get started a simplistic way, but then that's a first part where you could also get predictable solution coming across it as well. So there are multiple places where AI has been, I would say, imbibed now. Is not an option, but it's imbibed into the product building, and sustainability is core to it to look at there. We also look at the when we write the code, is the code is as well the sustainable code or not? Can I write the change algorithm, and can it also be use the less compute than what has been using with the different companies? There's a good algorithm that also proposed by the systems, and that's something we also try to use into the product as well. So there are, I would say, from the last couple of years has been an effort that we started doing from the industry-wise to the verticalize, how we can improvise across the board, and it's been now, I think, journey that we take forward.
Very interesting. Thank you.
Thank you, Mr. Rahul, for very thought-provoking inputs. Now, next question is for Dr. Naina. You come from the expertise from public health system. So my question to you is, how do you envision climate change affecting healthcare system, especially in rural and underserved areas?
Thank you, ma'am, for this question. And yeah, I'm here, the health sector person, I guess. I'm feeling alien in the technology field. But all of us have to remember one thing, what is health? So we all are working for health. Basically, I want to start with the definition of health. So I hope many of you know the definition of health. So health is state of complete physical, mental, and social well-being, not merely an absence of disease or infirmity. So if some person is not having a disease, is not healthy. So health starts from there. Our concept of health, it shouldn't be the absence of disease. So with that definition, whatever the changes we are having around because of the climate change, see, it's all are affecting us, but not showing physically we are unhealthy. It's not showing we are having some disease, but that doesn't mean it is not affecting our health. So, and basically one more thing I want to explain in brief, how the disease occurs in anybody. With that, we can relate it to the climate change and the health. We call it as epidemiological triad. So there is a concept of host, environment, and the agent. When these three things collide, then only a disease can happen. So a host is a person who is having a disease. An agent is the one which causes the disease, and the environmental factors which makes it vulnerable situation to have the disease. So when it comes to climate change, where it is becoming an agent also, and it is creating an environment where it is making the person have the disease. So in this situation, so climate change is in various aspects, it is causing the public health, it has become a public health threat, and it is a man-made threat, which has made it, and especially in the rural areas, there are certain diseases which are very much prevalent, and they are got affected very much in a high intensity because of the climate change. One is heat waves. So they are the one, the work is completely in the outdoor farmers. So they are hit more in intensity by the heat waves, one thing. And that is another thing is vector-borne diseases, like mosquito-borne diseases, tick-borne diseases. These dynamics of these diseases have changed because of the change in the climate. So initially, in a year, 2 to 3 months, we used to see the dengue cases or malaria cases in the monsoon. But that period has increased almost to 6 months in a year because of the change in the dynamics. That vector dynamics also changes along with the environmental dynamic, change in the climates. So it is giving more favorable environment to grow these vectors and spread from one area to the other area. So it's vector-borne diseases are increasing. Again, the rural area people are the most hit population in this because the preventive measures are very primitive there in the rural areas. Then the third thing is air pollution. Again, the air pollution, it is mostly we see in the urban areas, but it is still prevalent in the rural areas also because of the biomass use, one thing. And another thing is wildfires and the practices what they do in the agriculture sector, like burning of the, after the harvesting, they burn the things to clear the fields. So all these are the things which are contributing to the more air pollution and especially indoor air pollution. And again, it is affecting more to the women and elderly who are staying at the households. So it is, these are the diseases which we can see. And again, the mental health aspect, as I said in the definition of health, social, mental, and physical. So it's all aspect is hit by the climate change. So, and the vulnerable group is rural areas, as the health sector is not in a structured manner and easily not accessible. And the more worried things for them is physically visible diseases like fever or any other injuries, other diseases which are diagnosed. They are worried about those diseases than these hidden conditions or diseases. So that's why climate change has affected most of the people in all the sectors. So having more diseases, making the environment more vulnerable to have the diseases, especially in the vulnerable group, children, women, elderly. So these are the groups. Thank you.
Thank you very much.
Thank you, Dr. Naina. And it flows very well because the person sitting next to you is from green construction in terms of how to design and provide the brick and mortar to make it both environmentally and mentally and socially viable. Shrikant, this question is for you. Based on your experience, what actions can academia and industry take to prepare the next generation of architects in the field of sustainable design and practices?
That's a great question. First of all, good afternoon, everyone. I would like to congratulate Bengaluru City University and the University of Wolverhampton for this wonderful initiative and setting up this research institute. I think it has great potential. Just a little bit about myself. So I'm an architect and interior designer. My company is called Ecomini Studio, and as the name suggests, ecological and minimalistic designs is what we do. And I have experience in doing a lot of net zero and LEED certified buildings. So that's kind of the need of the hour in today's times. If you come to the construction industry in India today, it's going through a huge transition. There's a rapid urbanization that's going on, and a lot of people are moving to the cities, and there's just not enough resources, natural resources to support the system. So sustainable practices and net zero are definitely coming into prominence. In Bangalore alone, around 700 plus projects are LEED certified by IGBC, and there is, for example, like the Chinnaswamy Stadium went through a huge revamp of they're using solar power technology to completely power the stadium. And also big developers like RNZ and Embassy are also going into green initiatives. To answer your question, academia plays a huge role. In fact, sustainability should not be taught as one particular subject. I feel it should be a part of general learning every day. Like everybody should be introduced to this in school itself, and they should talk about different kinds of materials, play around with a lot of arts and crafts to try and figure out like how you can reduce waste and use those to repurpose them. So it all starts from the basic grassroots level, and then you can go into doing sustainability in your daily lives, saving water, saving electricity, using natural light and ventilation as much as possible every day in your homes. So that's where you can make a difference, and you can educate people to make a difference. Of course, when it comes to sustainability in a more professional level, it's more important for people to acknowledge that there is a change, there is this climate change as mentioned, and there is a lot of demand for such initiatives to take place, especially in a place like Bangalore, where there are a lot of corporates looking for completely green and LEED certified buildings. Just to brief you, so LEED certified basically means you're trying to reduce the waste in the building, you're trying to reduce the energy consumption, either through an efficient HVAC system, or you're trying to introduce natural ventilation, natural local materials. You're working with local artisans, and you're trying to bring in that local element so that you feel like your building is responding well to the climate, to the context it is in, and also to the people who are using those buildings. They should be able to appreciate the natural element out of it and try to maximize their usage but reduce the footprint. So that is where the carbon neutrality comes in. So all these are very important to be not taught professionally but kind of followed right from childhood is my recommendation. Thank you.
Thank you very much.
Thank you so much. My next question is to Dr. Krishna Prasad. Sir, you have an extensive experience in leadership role at various companies like Mercedes and Terex. So how do you see the role of automotive and manufacturing sectors in green innovation?
Yeah, hi, good afternoon again, and thanks for that question. So I'm more of a product development guy and more product innovation, but I've been lucky to work in some of the leading brands. And what I've noticed is especially in manufacturing operations, going back to what Shrikant was mentioning, we used to follow a lot of lean practices. And lean, one of the key mantras which typically we use is identify waste, remove waste. And even before this whole ESG certifications and so on, so always identifying waste and removal, and especially when it comes to power, energy, water, that used to be built into the kind of mindset of leaders, of people working in the plant, in the plant operations, etc. So I find it very, very important that it has to get built into the people's thinking, not because somebody is telling it, right? Or not because some auditor is coming and checking, okay, I'm doing this audit. So it becomes so very important, and we were very fortunate that we had some leadership who believed in that, who showed that commitment and said, okay, this is as important as running a business, building a product, and adopting these sustainable practices. So I think that is very, important thing. And then when I saw these plants, I kind of got reminded, one of the practices we would follow is every senior manager who would come into a plant would be given a plant to be planted. And that was, for the first time when I went, I was thinking, oh my God, like, is it possible to maintain all these plants and trees? And many times leaders, when they come the second time or third time, they would come and say, show me my plant. Forget about getting into the factory. First, show me my plant. I want to see it, nurtured well and growing. And they used to feel, every year when they come and they say, oh my God, my plant has grown, so high. So what I'm trying to say is some of this, is kind of really good to get it into our head. And then what we also saw as an indirect benefit is once you start hearing and seeing so much in the office, you also get it to home. You say, hey, look, why don't we save, power? And just because, we pay electricity bill and it's not so high, it doesn't mean that we waste power. So all that hopefully, will also get translated into home, and we can start showing our kids and hopefully neighbors in the community and lead to some sustainability.
Thank you so much, sir, for that.
Thank you for those wonderful, innovative and creative solutions embedded in organization. My next question is to Karthik. What role do you envisage from Deloitte in helping clients transition to more sustainable practices?
Okay, thanks for this question, and good afternoon everyone, and congratulations to the university, and at the same time happy to be here while we are celebrating the World Earth Day, and the topic is absolutely apt. And to your question, to our clients. Okay, so we do a lot of things again for our clients specifically, but I would like to touch upon certain areas how we impact the community and in a sustainable way, again, which are relevant to the topic which we are talking about, not specific to our clients. So maybe we are into innovation. Innovation is a practice within Deloitte. We have innovation hackathons, we have innovations competitions within the organization to come up with new initiatives. So as part of it, what we did was we have identified a specific problem which is causing most of the North India, basically especially during the winters and spring season, the stubble burning issue, which is causing predominantly healthcare related issues, and Dr. Naina has rightly pointed out where farmers were doing burning, and it impacts most of the people's health, but every time shut down the industries, shut down the construction, and a lot of such, again, Supreme Court comes heavily on penalties and all those things. So as a organization, what we did was we wanted to work out some solution. So we closely worked with Haryana government, and in the year 2023, we took over approximately 6 villages in a district called Karnal. And we developed a solution. Again, it's an AI-based application, and it also comes in mobile as well. And we took over these 6 villages to see how the stubble burning can be reutilized or effectively managed, such that it reduces the impact on the environment. Such that this solution also involves providing the necessary equipments and the machineries through the app, and it not necessarily they will allow to the farmers needs to buy all these equipments. Rather, they can share the equipments which are donated, where the application platform will help them identifying the availability of these equipments for them, when it is available, how to block it, and all those things. So first, initially, as a pilot program, it was launched in 6 villages in the district of Karnal. And end of this pilot program, it was identified that 64% of active fire and the impact is reduced in these villages. Later on, along with again the government support and the participation, this was expanded to close to 9 districts and 600 villages. And in 2024, we reduced close to 54% of the stubble burning cases, and the resultant life saved is approximately 5,500 is the estimated life saving through this program. And this particular project, now it is being expanded across Haryana, and very recently in the last hearing from Supreme Court had appreciated the efforts from Haryana and in fact put a note saying that why don't Punjab government should also look at such initiative and take it forward so that it can arrest these kind of issues. And based on that input, now Punjab government has signed up with us, and we have taken over 1 village in Punjab government, in about 1 district in Punjab border areas, and we are expanding this. This is not only to the clients, it's not about the client, it is to the society as a country, how we are going to make an impact in a sustainable way. And it's not about arresting the fire or its impact or anything. How do we channelize this stubble burning? It is a recurring issue. It keeps accumulating year on year. It keeps generating. So how do we reuse this stubble? So what we did was we aligned other industries. We connected other industries like ethanol manufacturing or bioenergy diversification and such industries, so that this stubble which are generated are sourced by these industries, so that it generates an income, additional income of 60 crores to these farmers. So currently close to 1.5 lakh farmers have registered in this application, and at any point in time in a peak season, 5,000 to 5,500 farmers utilize this particular service. It is absolutely free. There is no cost involved. Again, it is the way we give it back to the society. So this is one example. Like that, we have multiple other examples. In fact, I can quote one more example. We have our innovation center in Bangalore, actually, Deloitte Innovation and Technology Center. In this, we have developed a solution which actually now taken over by or utilized by Indian Air Force and HAL, where it basically with artificial intelligence and 3D simulation, the entire flight simulation is now carried out. In fact, we showcased this solution in Aero 2025 Aero Show, and Indian Air Force is now utilizing to train their Air Force team, and the HAL is utilizing this for the pilot training, which has effectively reduced the overall training time required, the manpower required, increase the efficiency of the pilots who are getting trained and all those things. And this is another way of giving back to our country, and how we, our sustainable solution and the innovation and the artificial intelligence helps us providing not only the clients who pay us, but also for the country it matters. Thanks.
Thank you so much for giving us examples and showing the impact. I would like to open the questions for the audience. Yep.
Namaste panel members, namaste everyone. Thank you BCU and University of Wolverhampton for giving us this opportunity. My question to the panel members here is, today we talk about AI integrated with sustainability. It might be AI with healthcare sector or AI with any sector where we focus on sustainability. Just basic question as a layman. Yesterday I was reading an article which says, if a user is using a chat GPT to get the answers, even if I say, thank you ChatGPT, you're beautiful, your answers are wonderful, there are lots and gallons of tons of water used by the servers in the backend, which is melting our earth down. So it might be the trend of Ghibli art. So we know how servers melted out. So the question here is, in the name of AI, are we really having a progressive development, or indirectly we are depleting our earth back? This is my question to the panel member. And the second question, I thank the panel members for beautifully discussing the factors of ESG, sustainability, carbon footprints. So right now in India, the capital market is also being integrated. We have something called as carbon derivatives, which is beautifully happening in India. But the question is again, is it really having a positive impact? We are also seeing the cases of greenwashing in the back end. So as industrialists, as the government sector, and as we as an individual, how can we avoid this greenwashing even from a small impact to a larger impact? So this is two questions posted to the panel members. Thank you.
Maybe I can take the first one on the AI and the carbon footprint that AI is generating, right? It's a pretty valid question, right? I mean, when the first time ChatGPT got trained, and then there is as well right now this madness going on around everyone trying to train the model. So basically, when you ask the question, thank you ChatGPT, it doesn't use much of a carbon footprint. So carbon footprint doesn't, so when you look at the AI model, it has two components. One is the training time, another is the inference time. Inference doesn't need so much of energy because it's already your model is trained, and you just need it's kind of you just retrieve information from a database a little more intelligently. So that doesn't need more. But the more carbon footprint need when you are training the model over the GPUs, and then that's point of time is a lot of I would say energy required to train these models with the billion of data points, the trillion of data points that required to be done. And it's a valid concern. It's not that we could just shy away that the AI would be not impacting the largely carbon footprint. What's been changing in the recent time as well, right? And especially when the DeepSeek has came a couple of months back, it also shows the way that if you have to really build these powerful models, you always don't need to do with the so much of energy and so much data point. You can really optimize it with the smaller energy and smaller footprint. You can still get the better outcome. Again, now the focus is on building the small models, so they call as and the multi-model, and there are different capabilities coming up there. So they're also breaking it in the larger space. The way I'm now working around the AI for last 10 years or so, last 3 years definitely fascinating with the AI evolution happening there. There is a way where it could get reduced, but I don't say whole thing would get consolidation. Would take another 5 years or so, where we really see how the energy consumption could be really optimized. It when the consolidation of that all the madness about everyone want to create the large language models, and it's not sustainable. Thus, from them, from even the financial point of view, right? Because people can't just investing when the models are not being used. So definitely AI agents has been another way of utilizing the smart way to, rather than you use large, but that also would increase the carbon footprint at the initial phase when you are building, experimenting with the many more agents that we are doing at this point of time. I mean, we are also doing many agentic capabilities, but eventually it will come down and help in reducing the part. But at this point of time, there is definitely a larger carbon footprint is getting generated because of the AIs at this functional point, I would say. It would come with sustainability I mean, I will be truthful. I have not been, I see hardly as you said, greenwashing is happening all over the place where people say, oh, we are doing so and so stuff there, but it would take time to really reach out that phase. Yeah.
Okay, let me add to him. And see, as you rightly said, as he rightly pointed out, it's the energy which consumes. Okay, so basically, for example, maybe saying hello or thank you won't make much of a difference because it's a basic training which is already trained. But say, for example, nowadays photographs are uploaded and it draw and give it back. So, for example, that each photograph will consume approximately 3.5 kilowatt of energy consumption, and this is nothing but you are charging your mobile completely one full cycle. So that is the kind of energy it takes basically. So how do we compensate it? Because several such queries and lakhs and millions of queries are being run at the same time. So how do we compensate is what we should understand how this energy is spent initially, because these are all the initial stage of innovation. So again, the innovation will keep on happening. So that is where organizations which innovate how to, first we should understand where we spend, how we spend on these energies, and then only we will be able to optimize it. So now the current status, the AI related innovations have happened and people are coming up solutions, large scale, large learning modules, small learning module solutions, and all those things are coming up. DeepSeek is coming up with a cheapest form of GPUs which can be processed, etc. But at the same time, now the innovation on which is happening at this point in time is, as we design this infrastructure which are required to process this, how much of energy spent, how much of carbon dioxide emission which is happening, carbon emissions which are happening, these calculations are also, it's possible now. And in fact, we have developed a tool, green sign tool, which actually when you design and build an infrastructure, it will give you what is the kind of energy being spent and the carbon emissions being carried out because of this, and how to address this. So as we speak, yes, the first step is we have innovated, come into the AI space. Now the second step is how to make it sustain. So that is where this green innovation and continuous innovation comes into play. Yes, there are solutions which are coming up. As I said, it may not take 5 years and all, absolutely, I beg to differ there. Maybe we are just a year away from that, and we will certainly, because the amount of efficiency which comes out from these AI modules, it's not about only training it, it is about implementing it everywhere. So the amount of efficiency, even the energy efficiency which it can bring in at this stage itself is close to 30-35% is what our study state says. So down the line in a year and a half, we will be in a place where completely fine-tune that, completely understand, do we really need to spend this amount of energy to get this outcome? There will be much more innovations are in the pipeline.
I think that's a great question. Again, a round of applause for that question. I think it's just not AI. I think when you look at any technology, there is an impact on technology. And for example, there is so much of discussion on electrification, electric cars. Why are still people not buying? Because there is still an element of economics which is bothering people. You know, a great case is an electric car. It costs 1.2 times a normal petrol or a diesel car. And then when I'm a consumer, I want to go, I'll keep thinking, oh my God, I need to spend 1 lakh rupees more. So it is also about economics. And especially when it comes to green and sustainability, many times it has to touch the heart, not just economics. If you try to convince people only through, hey, you'll save some money and so on, probably it will not work. And it has to touch the heart, and then people have to start believing, oh my God, I have to stop whatever, right? Consuming, etc. I think in your case, AI, I don't even know, unless somebody came and told me, hey, because you said thank you, I'm spending millions of dollars. I don't even know, because I'm just typing and I want some answer, I'd be done with it. But even when I see that I'm using a lot of paper, I'm using a lot of packaging, and apparently there is so much of landfill happening because of quick commerce. It has increased by 1.2 times from what it was just 2 years ago. Now because of quick commerce, because they just deliver in all kinds of packaging, so much of packaging, and 1.2 times landfill, because we don't see landfill. We are happy in our homes and we don't see landfill. So One is economics, and then hopefully it should touch the heart of people and say, oh my God, I'm not, contributing to the environment. So as always, it's a slow process. But again, this is a great forum. Again, congratulations for setting this up. And some dialogue happens and people go back and start thinking, right?
Yeah. Just to add on to that before the next question, these are the topics where Wolverhampton-Bengaluru Center of Research and Innovation can work with the industry. And one of the theme is a waste to wealth. How can we change the behaviors? So the questions asked here opens more research questions to be investigated further, and which is an opportunity for the center to work with academia and the industry. Yeah, thank you.
Good evening, everyone. My question is to Shrikant sir. So we were talking about the green design and green architecture, and you have quoted that 700 plus projects are running in Bangalore. My question is, what can we do for already existing millions of buildings which may have not gone through those phases, and what as civilians and universities we can contribute to make them as green design, the existing one? Is there any already innovative idea for that, or are we still in the path to do the research? Thank you.
That's a great question. Thank you. So basically, see, existing, there are so many buildings, and as you rightly said, there's nothing much anybody has done yet for those. I feel there's a great potential for retrofitting. If you heard of the term, there is it's a way in which they can revitalize those buildings, bring them back to life, not just cosmetically, but also ground up, work on the services of the building, work on how it is going to save energy for the occupants. It also works on the usage of the building. Sometimes, the buildings are not used for the purpose. They kind of get misused or repurposed in the wrong way. So sometimes understanding the life cycle of the building and also revitalizing it for a particular purpose will save the building. So that's one. Another thing is in terms of what general public can do for going green is, of course, as I mentioned earlier, trying to save energy on your own, in your own way, whether it's water or employing solar energy, or growing more plants, having a vertical garden, or even encouraging local artisans, as I suggested. There are a lot of hidden talent here. People who are doing some creative stuff with terracotta, with bamboo. They are using these very local materials to transform living spaces and also create some really unique art with that. So those are ways in which some individual can get involved in this field to begin with. Thank you.
I would also like to.
We'll take this question and that question and then go forward.
I'll make it very brief. Good evening to the panel members. This question is to Dr. Naina Madam. Hospital waste management is a big issue, and it leads to environmental degradation. So though there are rules in India, usually they don't follow it. Waste comes back to the market in another way to get cheap products for the poor or the unaffordable. So can AI help in controlling this? So this is the question. Thank you.
Green industry is there. Green hospital is also should be one of the area of research where energy is also consumed a lot in hospital sector, especially in the machineries, in diagnostics and all, as well as waste management. Definitely that is in waste management, very poorly recycled, very poorly disposed, and again the threat of infection is also high with the healthcare sector. Energy consumption, recycle is poor, and spread of infection is very the same. So that is again, it is in the hands of industries to develop more green hospitals and healthcare sectors where energy is consumed less and the waste management is done adequately. Because unnecessary products are used there also. We can minimize the usage of the things and maximize the recycling also. That is also one of the area of research, sir, that definitely taken up.
Yeah, to just add on to that, there's a lot of work that's currently, we at the University of Wolverhampton are looking into decarbonization of the healthcare, and right from the behavioral to the material waste to even the practices done, for example, in the ICUs, how can sustainability aspects be looked into, and from the carbon usage point of view. Especially one of the things that came to our attention when we did a pilot study was the gases that are being used for anesthesia. The amount of waste it happens when it comes from the source to the theater and then to administer. So the wastage is more than the actual usage. So those things are being explored as we speak.
Want to raise a question on the recent discussions that took place in the United Nations Forum, where they spoke about the emissions in Asian and African countries, which are increasing year after year. And the counter argument to that was that, industrialization has almost like reached its peak in the Western countries, and most of the natural resources were used by them, and mostly these resources came from the countries that they colonized. And today, when the Asians and the Africans are actually trying to build their economy and develop it, is it actually the right time for us to think about net zero and bringing down our emissions at the cost of our economy is growing? So I would like to get the perspective of the UK members in the panel and the Indian representatives in this panel on this issue. Do I have to repeat the question?
So thanks a lot for the question, and I'm not sure whether I'm the UK member or the India member actually. So I am not even sure whether Shiva is the Indian member or the. So I think, yeah, well, we're both. We're Indian and UK, and we're WBC members. I think it's quite important, and I mentioned this when I was did my introduction piece, that there's a role that academia plays, there's a role that industry plays, but then there's a bigger role that policy and politicians play, right? And how we bring all of that together is one of the key parts. I completely agree with you in terms of what's happened in the past has happened. We can't go back and change that, right? And there's no point discussing that. But I think collectively, as different nations, we need to really think about where do we want to go from here, right? Do we want to think about ourselves only? And it's detriment to what, and where does that leave the planet, and what would we be doing if, yes, we were very prosperous and the planet didn't exist anymore? So it's having the right kind of balance and really trying to understand the economic side of it, very important. How do we make sure we support businesses? How do we support people? Very important. But in the end, we only have, at the moment, one planet that we have, So I think my view is, and I'm not taking sides in any way, these are discussions that took place in the UK as well. We feed into a lot of government policies, and they keep talking about various things that they would like to either bring back, increase more, and the fundamental decisions are always taken with the view that if this is going to harm the planet, then we've got to look at an alternative solution. It might be harder, it might be costlier, it might be difficult, but the direction of travel should be there. I wouldn't go into the whole geopolitics nature at the moment where, you've got the Wild West, or in the West, you have lots of new things, new statements coming in, which, to be very honest, is really concerning for people like us who really believe in the change that's required to be able to protect the planet. When you've got very large countries like the United States coming and saying openly lots of different things against the whole climate change agenda, which really puts back the world, you know, and I think it's very important that everybody else then collectively join hands. So this is not the time to really start only thinking about ourselves, it's about how we collectively join hands and really start addressing this problem. It's never going to be easy, you know, but I do understand, you know, every government has to think about their countries, their citizens first as well. You can't even, you know, you've got to have that right balance, and that's why I'm not a politician. You should have talked to my boss about that, who was a politician.
To add to this, actually, most of Asians think in this way because many of the families, since 3-4 generations, they are trying to buy one car. Their dream is to have one car in their family. So at this stage, you people are, I mean, we or whoever enjoyed that facility are telling them, oh, you are doing bad to the environment. So their feeling is to have that luxury feel. But that's why we have to target that emotion that what we were there, that was a correct thing. Indigenous things we never used are in abundance, everything. We were reusing it, repairing the things and buying. But now buying has become very easy, and it is ending in wastes, lot of wastes. So that maybe the age-old things have to be reassured that we were in the right system. We need not get influenced by the Westerns or developed countries that we have to have those luxuries. I mean, I'm relating it to the diseases also. Now we are increasing the non-communicable diseases because of our food habits, which we are following the one which the developed countries followed. But we are not at the genes we don't have to, which sustain that abundance of food. Our genes are made up for starving. So if we have more food, we tend to have very high obesity and diseases. So I think we need to target those emotions where having those commodities is not the success in life. So maybe in that situation, that thing can satisfy the people's emotion that having those luxuries is not the thing. So that may add into the sustainability.
The needs versus the wants. What is needs and what is wants?
Good evening. I have one question.
Okay, this is the last one, if you don't mind.
I am Darshan from Commerce Department. Okay, manufacturing is okay, but its maintenance is very hectic, right? So we are talking about so much about green innovation. So in terms of medicine, green medicines, we have manufactured many green medicines from indigenous practices, but its maintenance is very hectic because it is very effective, but some after days it is perishabilities. It leads to perishabilities. What are the practices which we can save them? How to secure that medicines, green medicines?
I can take this because when you talk about green medicine, you have to define what is green. For example, Moringa powder, which here in many houses or in villages you get in the backyard. But in UK, it's packed and you pay literally an enormous amount for a small 100 grams. Yeah. So what is green medicine? And now if you look even at tea, you've got hibiscus tea. And hibiscus literally grows everywhere in the climatic condition, at least in Bangalore. So, and they said that's very good for health. Again, my question is, how do you define green medicine? And if you're looking into green from the herbal side, from where I'm talking from plant-based product, it's always, we've got the ancient history of how Ayurveda was used, so it's not something that's occurred. And in the commercial world, if you know the company Lush, you walk into it, most of the products there are plant-based. And it was very fascinating when I first saw coconut oil, which is part of the fabric of the society here. It's used very much as a hair mask, hair conditioner, and it's amplified so much, and we pay fortunes. The younger generation, at least in the UK market, pays fortune for coconut oil mixed with soap. And not only that, going further, turmeric powder. Nowadays you get in Starbucks Costa mixed with milk called golden latte. Again, it acts as a medical purpose. It's well known. In kitchen, it's their turmeric. You have a cold, put a handful of turmeric, drink hot water, your cold is gone. So again, coming back, what do you define green medicine?
Can I maybe just also add, I think you've got a very valid question. And why I think, I have no idea the answer, so I'm not going to answer your question because I'm not from that area, but why I think it's a very valid question is it actually addresses the heart of what is sustainable and what do you define as sustainability. And we always look at products in their silos as being sustainable, right? And we at Green Innovation Corridor at the University of London keep talking about end-to-end life cycles, right? It's very easy to push away, and say, okay, I'm not using a lot of energy to do something now, but actually later you probably might need that, and you just package that part and say, yeah, I'm very sustainable because my company is not doing anything about it. But then when you start looking at left and right, before and after, you've got whole issues. I mean, Srikanth and I were talking just before the panel started about the construction industry. So we look at sustainability from ground to building and back into ground. So what we look at is, if you've got brownfield land, we don't want to cut trees anymore. So effectively we want to look at brownfield land, which is all land that had something that was built before, it's not derelict. How can you repurpose the land, regenerate the land? How can you then look at modern methods of construction, modular construction, digital construction, all to be able to have a more sustainable building built? Then when the building is operated, when people are living in it, how do you ensure the building is efficient? And then when you look at demolition, we actually even do demolition in the university. We've got a master's program just on demolition science, which looks at how do you then do the demolition stuff, extract stuff, all of that. So effectively it's from cradle to grave kind of model across sectors. So we do similar stuff for batteries. So we had a lot of conversations, a lot of work, research work taking place with, of course, EV is quite important. Everybody talks about it, but what happens to the car when it comes to end of life, right? And how do you then do the recycle? So we've been working with battery manufacturers to look at, okay, when the battery life ends, how do you then recycle that battery and bring that back to life or use it for something else? So what is that circular economy piece becomes quite key as well. Solar panels, PV panels, everybody's used them, it's there everywhere. But when it was a big craze, everybody put it up and no one knew what to do with them when they come to end of life. So we've been working to be able to extract. So at Wolverhampton University, we're very, very good in 3D printing with metals. And one of the reasons we use that is it's got zero waste, near zero waste, right? So from a manufacturing point of view, you can print something with a powder and you don't waste anything at all. So that's quite key. But then when you look at combining different technologies, you look at that circular economy. So we've been working with people who make solar plants or solar panels. When they come to end of life, we can extract copper and other metals out of that and then use that to reprint something else. So it's again looking at that end-to-end life cycles and beyond becomes the key thing that I think will drive the green innovation piece. We shouldn't be just looking at it silos as just one product. So you're absolutely right from that point that you've come up with a medicine and you said, yeah, it's fine and it's green. What happened before that, what happens after that is the kind of things that we should be all addressing. So I go back to what Shubha said, these are the kind of things WBC should be looking at, the wider picture, the bigger picture that nobody else is looking at.
Thank you. Yeah, we'll just go further to close the session. Kritika ma'am.
It was indeed a very fruitful discussion which we had today evening. So I'm very, very thankful to all the panelists, those who are here, for coming all the way, spending your expertise and experiences and sharing your insight with us. First of all, I would like to thank Mr. Prashant Pillai, Pro Vice Chancellor from Wolverhampton University, Sir, we look forward for more such kind of collaborations under our brand of WBC. Thank you so much for all your initiatives. I would like to thank our guest, Mr. Rahul, who is from SAP. Sir, very, very thankful to you. Sir shared with us how AI is going to bring us a sustainable practices which he has followed in SAP. Thank you so much, sir, for your contribution. Thank you, sir. I would also like to thank Dr. Naina. She has given us a lot of insight about how the healthcare and sustainability can be brought together. Thank you, madam, for all your insights and inputs. Thanks a lot. I'm highly thankful to Mr. Shrikant for bringing to us a very unique way of telling us how the green practices can be followed in the construction and sustainable design and practices. Thank you, Mr. Shrikant, for your valuable inputs. Thank you. I'm also very, very thankful to Mr. Shrikant, Karthik sir, for sharing with us what are the practices which you have followed in Deloitte. Thank you so much, sir. Your initiatives and the practices has brought a lot of experiences for us. Thank you for sharing with us. I would also like to thank Mr. Krishna Prasad, who has come from his leadership provisions in Mercedes and TEDx. Thank you, sir, for sharing and information with us. With this, I would like once again thanks all the panelists for coming together this evening, and we look forward for your more inputs, more collaborations, and more such kind of thought-provoking discussion with you all. And we would like to carry forward this collaboration under the brand of WBC. I would also like to thank our Honorable Vice Chancellor, Dr. Jalaja Madam, for being with us today evening. Thank you so much, Madam. I would like to thank Dr. Jyoti Madam for all the initiative which she has taken for bringing together this event. Thank you so much, sir, Madam. And our thanks to Dr. Subhashini Madam too much, because without her and without Dr. Suresh, this particular program and this WBC center would not have been happened. Thanks for everything, madam. A great round of applause. I would like to personally thank you. Thank you. I would also like to thank Dr. Suresh. Sir, thank you so much for this initiative, and we look forward for a lot of different programs and different kind of collaborations which we can bring together under this particular center. I would also thank Dr. Giri Narayan sir for always with us. Thank you so much, sir. And I would like to thank my colleague Dr. Nirmala, who is here. Thanks for all your support. I would like to thank each one of you, all the faculty members, all the students, research scholars, for being so patient, and you were such a lovely audience. Thank you, each one of you, for being with us today. Once again, I thank you all. Thank you.
Thank you, Professor Kritiko. Everybody, please be seated, because there's a last thing coming. So a massive thank you for being here and walking the journey with us from morning. It's past 5. I want to close the session by giving prizes, announcing the prizes for the posters. So the best poster run-up poster prize goes to Sarah Elmarni. She's not here. So I'll take it to Wolverhampton. All right, before I do that, let me tell how rigorous the process was. We had 44 posters that were successfully accepted. We had over 55 posters that were submitted, and we had to send feedback and to many in terms of rejection. So our aim next time is, I see the quality is increasing, so the acceptance rates are going to decrease, and that's where we want to see the quality of our students produce work to the international level. So with this 44, what was done is it was displayed, and there were 2 assessors, one from the academia, one from the industry. Nobody was involved in the poster preparation or in the supervision from the assessors panel. and each of the assessor had to assess a given number of posters, and they had judging criteria, and it was a score of 2 themes for 50 points each. So when one assessor assessed it, they gave us the sheet. It was headed by Dr. Wani and a team. Assessor gave assessor 1 scores, assessor 2 scores. They did not know what the other person's scores were. And then it was tabulated in a spreadsheet, and then the average score was taken. So completely objective from none of the supervision team or from the students. Then, as we tabulated it, the highest poster score went to the first prize, and thereon in terms of the order. So the second best poster prize goes to Ms. Vanishri. Yeah, so this is the poster that Wani The next best poster runner-up prize goes to Deeksha. The third best runners-up, if I request Suresh to come and accept it, if that's okay. He's not part of the supervision team, but this is for University of Wolverhampton. Suting Gyo. Yeah, and now the best poster prize goes to Ganapati Hegde, and this is, the title is something to do with hospital. Hospital at home. Yeah, this is the one. You have to give. Gentleman. Okay, can Vikram come on the stage, please? So that concludes the prize giving ceremony, and I would give my massive thanks to each and everybody on the dais, off the dais, the current Vice Chancellor, the previous Vice Chancellor, the Senate members, syndicate members, and both the university staff and students to put this great show in terms of co-creating the idea to the execution and launching the Wolverhampton-Bengaluru Center for Research and Innovation. With that, I close this event and wishing you all safe journey back home. And we'll keep the collaboration ongoing. It's just the start of a great journey. Thank you.